we have such an important topic to talk about. We're talking about how to help keep pests at bay, especially when we're in the outdoors, this summer especially. So let's get started with the question. Do you know why tick-borne illnesses are on the rise?
Well, there's a host of reasons why they're on the rise. And basically it comes down to conditions are better for their survival. There's more mice, more chipmunk, and more deer for them to feed on. And so it's easier for them to thrive. And the range of the ticks is increasing. The winters are not as severe as they were. They're not dying off as much as they used to in the winter. And they're expanding into new ranges and coming into contact with people who are now vulnerable for these tick-borne infections. So in the last 10 years or so, there's been a threefold increase in tick and mosquito-borne infections in the United States.
That's such a high number. What are the most serious problems mosquitoes and tick bites can cause?
Well, the bites themselves are pretty much only a nuisance. The real problem is if an infection is transmitted because of the bite. And, you know, there are more than 65 infections that can be transmitted by ticks. The most common in the United States is Lyme disease, but there are others that many people have heard of and can be life-threatening, like Rocky Mountain spotted fever. Perhaps well less known, anaplasmosis, babesiosis, or ehrlichiosis are other tick-borne infections that can become quite serious and even lethal if not diagnosed and treated. With regard to mosquitoes, the leading infection is West Nile virus, which generally is not a very life-threatening infection, but unfortunately sometimes it is. It can cause paralysis and even death. Other infections, of course, are very famous for how dangerous they are. Malaria, dengue, yellow fever. We recently had a lot of problems and news about Zika, which did reach the United States and was being transmitted in the United States. Dengue, chikungunya can be transmitted in the United States. So there are a host of insect-borne infections that exist in the United States.
So what advice do you have to keep these pests off us and out of our yards and especially our homes?
Well, there's a number of things that can be done, and there's sort of like different orders of magnitude. First and foremost, insect repellents work and they should be used. They're effective against mosquitoes, they're effective against ticks, and diminish the risk that they will want to bite you in the first place. And then secondly, we have to think about what we're doing when we're out and about. In the summer, it's great weather. People like t-shirts, shorts, and flip-flops. But if you know you're going to be hiking in a tick-infested area, that's probably not the way to go. You know, long sleeves, long pants, boots, maybe tuck your pants inside your socks. All will make it much less likely that a tick can attach itself or a mosquito can bite you. Another thing which is probably less well known, for instance, with tick and the transmission of Lyme disease, is the tick typically needs to feed for 24-48 hours before the infection can be transmitted. So it's important to get in the habit of doing a tick check and look to see if there's any ticks after you've been out and about on your body, because then they can be removed and it will prevent the transmission of infection.
And so we are wearing protective clothing, we're using repellent. What happens, what should you do if you find a tick on yourself, especially your child or your pet?
Well, first and foremost, don't panic. You know, the tick's not going anywhere. The thing to do is to get tweezers, try to grasp the tick as close as possible to the skin, and gently but firmly pull back. No quick jerking, no twisting. We want that tick to come off intact. And slow but steady is the best way to remove the tick. And then you can clean the skin where the tick was and dispose of the tick down the toilet or seal it in a bag and throw it in the trash.
How can we eliminate mosquitoes or ticks on our property?
That's a great question, you know, and I think there's two parts to that. One is not let them in the house. And so for there, we want to make sure that we've sealed cracks, that our screens are intact, and so forth. And then the second part is what's going on outside our property. Is there stagnant water? Mosquitoes can breed in a half an inch of water. That's all it takes. And so it's important to inspect, go around, empty that stagnant water, make sure your drains are clean. With regard to ticks, you want your well-maintained lawn, you want to get the weeds away, you want to get the debris away so the ticks don't have an opportunity to get as close. And there, very often, it's good to have advice from a pest professional who can do an assessment and evaluate what your risks might be and how to mitigate the risks so that you can eliminate those pests.
So you talked a little bit about different infections. Can you tell us what are the symptoms of Lyme disease?
Well, I think most people need to know that often they don't recognize that they've caught Lyme disease. The first and very common symptom of Lyme disease is the development of a rash, of a ring-like or annular rash that often clears in the center. So you'll hear about being a target rash or a bullseye rash. It's called erythema migrans, and it appears in 70% or so of cases. And then it goes on to develop additional signs and symptoms like joint pain, low-grade fever, body ache, and then it can even go on to invade the nervous system and give, the headaches, photophobia, a type of meningitis that's not immediately life-threatening like meningococcal meningitis, but neuro-Lyme is of course concerning and can cause sleep problems and nerve problems. So there's a whole host of symptoms that can develop with Lyme.
Of course, how are these diseases diagnosed and treated?
Again, it also all depends on the disease, and the short version is first, depending upon the signs and symptoms, your physician will start to suspect one over another infection, and then there will be confirmatory tests that can be sent that can try to rule in or rule out the infection. With regard to Lyme, there are a host of different antibiotics that are quite effective. Lyme, especially when treated early, is quite curable. On the other hand, things like West Nile virus and a number of other viruses, we don't have an effective treatment and we don't have an effective vaccine. Zika, chikungunya, dengue, all like West Nile, there's only supportive care that can be given. And what you really want to do is try not to get the mosquito bite in the first place.
Of course, and these are really some great tips and some great information just in case we really want to watch out and protect ourselves this summer. So where can we get more tips on avoiding these summertime pests?
Well, I'd like to refer you to the pestworld.org, the website of the National Pest Management Association. It's a great resource, has lots of information about insect-borne infections and other pest-related problems, including how to mitigate your risk. The other thing I can say is if you really do have a problem, do not hesitate to seek out a pest professional who can help assess your risk and mitigate your problem.
Well, Dr. Parada, thank you so much for providing such important tips and safety information today. Thank you for joining me.
Thank you.